Welcome back. Well, we all want to know about dermatology and aesthetics. So today we have Dr. Kristy Fleming, who you may have seen on the front of our local magazine, who is with Fleming Dermatology and Aesthetics Center, and we're going to talk a little bit about some treatments and surgeries and other things. Well, welcome.
Thank you.
So you've been here for about 2 years now.
About 2 years.
Okay, and tell me about your center.
Our building was formerly the courthouse, and then it got sectioned off, and now it's all doctors and dentists, and it's a nice little medical center, kind of tucked right behind Dr. Manger's office.
Okay.
At Coastline Church.
Okay, great.
Yeah.
So not too far away.
Not too far at all.
And then, so May is a special month. I know we're coming to the end, but tell me why.
May is Melanoma Awareness Month.
Okay.
So we're really trying to get the message out to the community about skin cancer and what to look for and how to prevent it and how to protect yourself and your loved ones.
And we were talking a little bit before the segment about our weather, right? So everybody
Yes.
probably thinks there's no sun, but that's a myth, right?
And this is one of the most dangerous types of weather because it's not hot, it's not sunny, but those UV rays are still coming down and you'll still get burned pretty badly.
What are some things that people can do to help prevent that?
I like to go with a multi-layer approach. So avoiding the sunniest times, if you can, schedule your walks or your activities in the morning or in the evening. Shade structures are fantastic. I actually picked my kids' preschools based on which ones had shades over over their equipment. And then protective clothing, actually. There's a brand called Coolabar. They make UPF 50 hats. They make little gloves that you can wear for driving, long sleeve, but cool shirts, especially good for golfers.
Right.
And then I like to think of sunscreen as kind of the last line of defense. If everything else fails, then at least you have that protective layer.
Okay.
Yeah.
For our community, is there some things that people should be considering at this particular age? Like, is our skin more susceptible as we age?
It's actually the most dangerous time is when you're young. So you get about 80% of your sun damage before the age of 18.
Okay.
So what that means is most of it's already happened. I have a lot of patients that come in and they'll have a spot on their chest and they say, well, I haven't exposed my chest in 40 years, but they did when they were a child.
Okay.
Yeah,
All
so
right. And what are
it's
some
really
of the treatments that people can do now to, remove some of that?
Oh, absolutely. We have several different treatments, and that's based on someone's degree of damage, their ability to have a certain amount of downtime, and whether or not we're trying to just treat those little precancer spots or if we're trying to get a nice cosmetic result too.
Okay.
So we do a lot of chemical peels. There's also a procedure called photodynamic therapy where we apply a chemical on the skin. It sensitizes the skin, preferentially taken up by the damaged cells.
Okay.
And then you sit under this lamp, it's a blue light, which activates the chemical and destroys those cells.
Oh.
Yeah, I like to think of it as going on the offense as opposed to the defense, because it gets rid of those precancers that you can see, but it also helps getting rid of those damaged cells that are still hiding under the surface.
Now, how does that one differ from like an IPL treatment?
The IPL is a cosmetic treatment.
Okay.
You still get a nice cosmetic result with the photodynamic therapy as well, but the IPL is not going to focus on those precancer spots. It could make them look better for a little bit, but it's not really targeting them and destroying those damaged cells.
Okay, and what was that one called again? The one that you said you activate the light?
Photodynamic therapy.
Photodynamic therapy, okay.
Yeah. PET.
PET, all right, good to know. So what are some, I know we talked a little bit about sunscreens. If you were to tell them what would be the most important thing for them to use? Would it be sunscreen or would it be the other things that you mentioned, like the hats and things like that?
Well, you should still put sunscreen on every day because you never know what's going to happen or get stuck somewhere, and you at least want that layer of protection on.
Okay.
But what I tell my patients, there's basically two types of sunscreen, a chemical sunscreen and a physical blocker.
Okay.
I really prefer the physical blockers, and so what you want to look for in your sunscreen is a high concentration of zinc and titanium dioxide.
Okay.
That reflects the rays off of your skin as opposed to the chemical ones that undergo a chemical reaction. The problem with the physical sunblocks is they tend to be kind of white and
Yes,
cakey.
right.
Those are like the baby
Right.
baby ones. But there are new formulations out now that are completely clear. Some have a little bit of a tint, so they're a lot more elegant and
Okay.
yeah, easier to find and wear.
And we'd be able to find those just at the regular store?
Oh yeah, we sell a brand called Elta MD, and it's great for faces, acne-prone skin, after procedures.
Okay.
There's a really good brand called Blue Lizard that was originally developed for Australian surfers, so it's
Okay.
made for people going in and out of the water. It's a very good protector.
Okay.
Yeah, and of course Neutrogena. I can't be a dermatologist without promoting
Oh,
Neutrogena.
that's good. Well, that's good. All right. And you know, you can find that a lot of places too.
Absolutely.
So perfect. Let's talk a little bit about some of the surgeries that you do. Mohs surgery in particular. We had a little bit of discussion about that.
Sure.
How does it work?
Well, it's named after Dr. Frederick Mohs. He is actually a general surgeon who developed the procedure. And what it does, basically a patient with skin cancer would come in, we do just a local shot, you're not under general anesthesia, and we kind of scrape away the skin cancer, try to delineate the edges, and then take a small rim of normal appearing skin from what we can see as the skin cancer,
Okay.
put a temporary bandage on, and then there's a histotech that comes in and brings their machine so that we can turn that tissue into slides, and we make a map on both the tissue and the slide and the patient, and then I look at it under the microscope and I can tell if there's a little bit of skin cancer left in one quadrant or another. We go back in, take another layer, and make sure that's cleared. So we make sure that there's no cancer left in the patient by the time they leave, but we're saving as much good skin as possible so you get the best cosmetic result.
So it would be better to choose that over a different, what other kinds of surgeries would someone look at?
You can, just a regular standard excision where you take margins just based on what type of skin cancer it is.
Okay.
And why would anyone ever do that? And that's just based on insurance
Okay.
and Medicare. You have to meet certain qualifications. It has to be on the face, or it has to be an aggressive tumor.
Right.
Otherwise, we have to just take it out regularly.
Okay, all right. But Mohs is an option for lots of people.
Oh yeah.
Okay,
Yeah.
great.
Do it every week.
So you do it every week, but you do it on certain days, or?
On certain days, because we have the histotech that brings in
that's
their
right.
big machine.
Okay.
Yeah.
Okay. Well, great. Well, tell me again where you guys are located.
We are located right off Moulton.
Okay.
On Lake Forest.
Okay. Perfect. And if somebody wanted to get in touch with you, they can go to your website, right?
Website.
Perfect.
Fleming Derm.
FlemingDerm.com, right? Perfect. Well, thank you. It's very nice to meet you.
Oh, me too.
We will be right back after this.